going to call the meeting of Senate Education and Health to order. Mr. Clerk, would you please call the roll?
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline. Senator Peake. Senator Edwards.
Here.
Senator Chafin. Senator Hashmi. Madam Chair, you have a quorum.
Thank you, Mr. Chair. Thank you, Mr. Clerk. We have, it appears that we started off with 5 bills in the committee, but right now we're down to 4 because as I don't see the last bill on this list. So we'll start with Senate Bill 5028, Senator Newman.
Madam Chair, could that bill go by temporarily?
Without objection, the bill will go by temporarily. Senate Bill 5064, Senator Lewis. Mr. Clerk, is this patron not present?
No, ma'am, he's not in yet.
We'll go now to Senate Bill 5109, Senator Chafin. Yes, sir, I know you're here. I want you to present your bill. And the other 2 bills that we have listed, 5114, Senator McDougal, and 5116, Senator McDougal. And Senator McDougal is not present. Senator Newman, there's no one present except you.
You get to present them all, Steve.
Madam Chair, I've never had the privilege of filibustering, but I think that today might be a good day to do that. Mr. Chairman, Madam Chairman, I have Senate Bill 5028. Madam Chairman, in its clearest perspective, I don't think we should need Senate Bill 5028 because Senate Bill 5028 is a bill that states what's in the Constitution of Virginia. The Constitution of Virginia in Article 8, Section 4 says that the supervision of our public schools shall be vested in the Board of Education and its 9 members. Madam Chairman, as you may know, there are provisions also in the Constitution that speak to a local school board. Madam Chairman, as you also know, that this bill just makes it very clear that when it comes to issues related to health that impact our schools locally, regionally, that we should get input from the administration, we should get input from the Commissioner of Health. However, we should not have an order, an executive order in particular, that it appears to be in contradiction to Article 8, Section 4. Madam Chair, I've gone back and looked and saw kind of what has happened on this, and it's a bit different than what you might think. What you might think is that there was an order that came down sometime last spring that closed the schools, and there just wasn't, that I can find there isn't. There was a press conference, but no executive order, and I think there's good reason why there wasn't a executive order, because that authority does not reside in the office of the governor. It does instead reside in the Board of Education. Madam Chairman, so why does it matter? In other words, what difference does it make? Well, there's a couple of things. One is that if we have an order by press conference that does not have an executive order, it's unclear what the law is. It's unclear what school divisions are what they have to do. It also is a problem as it relates to liability. And let me talk to you about liability because it just matters. The fact is, Madam Chair, is that we did get an order that was, quote, phase guidance for Virginia schools. That phase guidance, as most of you know now, was in a number of ways much more strict than what the CDC had put out, and it did not really take into effect the regionalism and the differences that occurred in different areas of the state. The problem is that some of our school divisions were told immediately that the recommendations had to become the standard or that their liability insurance would not kick in. In other words, that as long as that, quote, guidance was out there, that the liability insurance simply would not kick in because it would be that they appeared to knowingly and willfully violated the guidance. Not long after this, quote, phased-in guidance was issued, there was another press conference. The next press conference, Madam Chairman, indicated, I think, the law as it really is, and that is that the phased-in guidance that was talked about at the first press conference as being the rule isn't the rule at all. Instead, what it is it's a suggestion. The problem then became that even as a suggestion, then, not an executive order, just a suggestion, that you still had a liability problem because that sat out there. And as a result of it sitting out there, school divisions either had to comply with that or not with what the CDC said, but instead they had to move forward in that manner. Madam Chairman, I don't think that the Article 8, Section 4 of the Constitution can be much clearer. It's very clear about where this issues. This bill, if you look into this bill, the bill is relatively simple and straightforward. The bill basically says that we encourage, or we certainly allow and encourage, that everyone will provide information to the state school board, but the state school board would make the ultimate decision. Madam Chair, there's some reasons to do that in addition to liability, confusion, and this item of the Constitution. It's because the decision as it relates to schools is complex. It involves how are you going to deal with the SOLs, the state requirements for SOLs? How are we going to deal with graduation requirements? How are we going to deal with grade level promotions? How are we going to deal with awardings of the standard and verified credits, the grading, the school accreditation, the local school division's budgets, the nutrition program, special education and otherwise, that aren't embedded in a statement that's made at a particular press conference, but instead it is something that a state school board under Article 8, Section 4 would be allowed to be involved in. At this point, Madam Chair, I think this bill is clarifying that the section of the code, the Constitution that relates to the Department of Education and also local school divisions is the operative information. I think the governor's office understood that when he revised his phased-in guidance for Virginia schools away from being a mandate and to being a recommendation. But, Madam Chair, that is the purpose of the bill that's before you, 5028.
Thank you, Senator Newman, for that presentation. Just checking on the registration report, there are 3 citizens in queue to speak to the bill, and the first person is Todd, it appears Gathje, Gathje, on Senate Bill 5028. Mr. Clerk, do you have Todd in queue? Go ahead. Public comment? Todd Gathje. Good morning. You're on. Todd? Unmute. Still can't hear you.
I think it's a technical issue on our end, Madam Chair. We're working on it.
Todd, could you hold for just a second? I think we may have a technical issue on this end. I don't think he can hear us either. Steve is texting.
Can you unmute your mic? Todd?
Yes, can you hear me?
Yes, sir, we can hear you. Do you want to try your video as well?
Yes, I will.
Todd, we want to hear you on Senate Bill
Yes.
5028. Go right ahead.
Great. Thank you so much, Madam Chair. Appreciate the time to speak. On behalf of the Family Foundation, we believe this is a good bill. It's needed clarification on some executive powers during a time of emergency related to public and private schooling. It also upholds the principle of letting the localities make these important decisions. I think that Senator Newman described the bill very well in all of the background. Let me just give you just my own personal experience with this. I live in Hanover County. My wife and I, we have 4 kids, high school, middle, and elementary. And so we're given the option in Hanover County to either send them to a 5-day-a-week in-person schooling or a full-time virtual classroom. And so we've decided to send them in person, and maybe some localities choose only an alternative, maybe another alternative, virtual. I'm not arguing the merits of one form over another, but what I appreciate is the options. And what happened in Hanover County is they convened a working group in consultation with school administrators. Public was able to give comment and feedback. And so they were able to present a plan, a back to school plan to the school board that made sense to them, made sense to the locality, giving parents some options. And so I think that this bill would go a long ways in upholding those principles that allow local school divisions, local school districts to make those important decisions based on their own resources, their own needs. And so we want to make sure that that those rights and privileges are given over to the localities in making these important decisions. So I really do hope it'll be the pleasure of the committee to report this bill. Thank you.
Thank you for your comments. Second speaker is going to be Dr. Oliver Nord. Dr. Norm Oliver.
Thank you, Madam Chair. I would like to yield the floor to Secretary Kerry, who will be speaking on behalf of the administration on this bill.
Thank you, Dr. Oliver.
Thank you very much, Madam Chair and Commissioner Oliver. The administration is strongly opposed to this bill. The COVID-19 pandemic has been unprecedented and rapidly evolving emergency situation for the Commonwealth. The response to the pandemic has demanded rapid and efficient decision-making. There may be a need that arises during a public health emergency where the board or the commissioner on the board's behalf would need to make an order related to school operations to prevent the spread of a communicable disease. In addition, this bill also impedes the ability to deal with all hazards, whether that be a toxic spill near a school that presents a public health challenge, whether there's a nuclear accident near a school, or whether there is a dam break or a flood that would require a public health order. So thank you for this opportunity to speak. And again, the administration strongly opposes this bill. Thank you very much, Madam Chair.
Thank you so much, Dr. Kerry. There are no other speakers for Senate Bill 5028. I will now turn to the committee for questions, remarks, or motion.
Madam Chair,
Senator Newman.
if I could just kind of sum up. Madam Chair, it is a bit concerning to hear that there are those that believe now that Article 8, Section 3 means Section 4 means something different than what we understood it meant a year ago, but also what we understood after the second press conference where the phased-in guidance was changed to a recommendation. There was, as you know, litigation lined up in far southwest Virginia that would have addressed this, and I think that it was very clear that they would have won based on Article 8, Section 4. So I think that this is very clarifying in what the Constitution says. Number two, Madam Chair, is I understand that the first speaker talked about this as it relates to whether a school opens or closes or full-time or whether they are going to be remote. This bill just doesn't get into that. It just is the question as it relates to that section of the Constitution on who is allowed to make the decisions as far as shutting down school divisions. So, Madam Chair, that's the purpose of the bill, and I hope that you would strongly consider it.
Thank you, Senator Newman. Any other member of the committee?
Madam Chairman, Senator Donovan.
Senator Donovan?
Thank you, Madam Chairman. I just want to speak to this. I think this bill supports in code what our Constitution instructs us to do, which is to respect the school districts. I think this is particularly concerning as we look at reopening schools. And Madam Chairman, if the advice given to school divisions from the state had been find a way to safely open schools for teachers and for students, they would have set about a task which they originally thought they were supposed to be doing in a much different way. And I think we would have had a lot more handovers, and they would have reflected the safety that we've seen throughout the course of this pandemic in nursing homes where there's been only one outbreak. And it would have reflected the best evidence we have, which is the advice from the American Academy of Pediatrics, who resoundingly, in their opinion, said the biggest risk to our children going forward is not the virus, it is not opening schools. We've talked about this a little bit, Madam Chairman, but school is more than curriculum that can be put over the internet. We have all sat here for years and ensured that our schools have enormous investments to be a good place for our children to be. And it's much, much more than curriculum. So, Madam Chairman, I think we missed the boat this year. I think that we have put children in jeopardy this year by not allowing the school divisions to do what naturally they would have done had they not received advice on regulations instead of what they should be, what their goals should have been. In any case, Madam Chairman, I support this bill, and I hope the committee will, because I think it's going to clarify going forward how we proceed to make sure our children are actually protected as we all want them to be. Thank you, Madam Chairman.
Thank you, Senator Donovan. Any other members of the committee? We operate on motion. It's been moved and seconded that the bill be reported.
Substitute motion to
Senator
pass,
Edwards, substitute motion.
pass the bill by indefinitely.
Substitute motion is that the bill be passed by indefinitely. All in favor of the substitute motion, please record your vote. All right, Mr. Clerk, would you please call the roll?
Senator Saslaw. Senator Howe. Senator Newman. Senator Locke. Senator Barker.
Aye.
Senator Peterson. Senator Cosgrove.
No.
Senator Lewis. Senator Donovan.
No.
Senator Suderline.
No.
Senator Peake.
No.
Senator Edwards.
Yes.
Senator Chafin. Senator Hashmi.
Aye.
Senator Lucas.
To the PBI, aye.
Seven ayes, 7 nays.
Motion fails.
Madam Chair.
Senator Newman?
Madam Chair, if you had allowed, could the bill just go by for the day, and then we'll just, I know we have a couple members that aren't here. We'll just see how they feel about it, if you're okay. We may not have another meeting, but at least we'll get a disposition.
Ms. Clerk, could you tell me when we might be meeting again, this committee? Anybody guess?
Madam Chair, I do not know.
Senator Newman?
I think what we're going to end up with is no recommendation, which is the same as having it sit on the table if the votes stay the same. So it's probably the same thing to just leave it on the table. And if we do have another meeting, we may
At the
have a full
recommendation of the patron, the bill will lay on the table. Mr. Clerk, we want to just pass this bill by for the day. Same as laying it on the table. Thank you. Next bill on the agenda this morning is Senate Bill 5064. Senator Lewis? Still not here. Next bill 5109. Senator Chafin?
Thank you, Madam Chair. What this bill does, it requires that the Commissioner of Health ensure that residents and employees of nursing homes receive first priority treatment in any testing concerning whether or not COVID-19 virus is present. And I would say that as everyone in this room is very well aware, the brunt of this pandemic has been shouldered by our most vulnerable citizens. Those are our senior citizens that are in these nursing homes. In fact, close to 70% of the deaths that have occurred in the Commonwealth of Virginia have been senior citizens, most of them in nursing homes. And at the same time that all this was not happening, great emphasis was being placed on the testing of Department of Correction prisoners. So while we're testing all the prisoners in the DOC, our senior citizens were being tested at a very small fraction of the rate that the prisoners housed by DOC were being tested. So, Madam Chair, we had this great story to tell in the Commonwealth about the safety of our housed criminals, but not so much about our senior citizens. And so this bill would hope to right that ship and would set a course for the future that with regard to COVID-19, we're going to pay attention to our most vulnerable senior citizens who have suffered the greatest price for this pandemic.
Thank you, Senator Chafin. For Senate Bill 5109, we have speakers. First speaker in queue is Scott Johnson.
They are not on the line, Senator.
Is not. Second speaker, Debbie Taylor.
Debbie, if you could unmute your microphone.
Okay. Good morning, Chairman Lucas and members of the committee. I'm Debbie Taylor, representing AARP Virginia. We support Senate Bill 5109 as nursing homes have seen a disproportionate number of infections and deaths from COVID-19. Thank you.
Thank you. On Senate Bill 5109, next speaker is Param Jaberi, Jaberi.
Good morning, Madam Chair.
Good morning. You're on.
The administration opposes this bill. We have had several conversations about prioritizations of specific subgroups being codified in a bill. And certainly the responses that have been made is accurate. Those who are elderly are at highest risk of morbidity and mortality from this illness. The governor has moved to create the long-term care task force specifically dedicated looking at issues with regards to COVID-19 in our long-term care facilities, which include skilled nursing facilities, assisted living facilities, and we're continuing to look at others, including facilities under the Department of Behavioral Health and Developmental Services. So we clearly understand the need to prioritize scarce resources We are working through this process with our partners or stakeholders, getting continued advice through the Governor's Testing Advisory Council as well. So while we agree in principle that we need to continue to focus on this population, we are in opposition of the specific bill as proposed and stated onto itself.
Thank you very much for your comments.
Madam Chair,
Senator Newman.
would it be appropriate to ask the witness a question, or is that technically not possible?
I was going to ask the same thing.
Senator Newman.
Madam Chair, just to the gentleman, and thank you for coming and testifying. Sorry we can't be together in person. Madam Chair, I'd ask the gentleman, does the administration, I guess, agree with the quantitation of the problem? One, that over 60 years of age, the vulnerable population has accounted for just over 90% of the deaths in the Commonwealth. Number two, that you get down to a 0.0001 in nursing homes, but they account for 60% of the deaths. And Madam Chair, I guess the question is does the gentleman kind of agree with that situation as he presented his thoughts to us today?
Okay. Laurie.
Senator Newman, if you could help me understand what you meant by the 0.0001. I certainly agree that very high
Sure,
level
Madam Chair, I'd be glad to clarify with your permission, Madam Chair. It is the percentage of the Virginia population that is in nursing homes. In other words, they represent this very fractional amount of of people in the Commonwealth. But sadly, to you and to me, I know to everyone, they represent 60% of the deaths. In other words, 60% of the deaths. And so I guess if that number is correct, then the question would be, would there not be some need to have a prioritization of the testing in an area where you have a minuscule amount of the population, however, you have an unbelievable amount of the deaths, right? So that question is out there, and it's under the backdrop of right up until about, and I'm going to get the days wrong on this, I don't have it in front of me, about 40 days or so ago, we had not tested all those individuals once. And I know everyone wanted to, you did, I did, everyone, but it would seem to me that the priority, if we wanted a Marshall Plan, if we wanted to do something to protect seniors, maybe this would help. So that's kind of the question, sir.
Sure. I think the way we have implemented our strategy is certainly respecting what you were saying, and that's the goal of public health, is to have our limited resources, scarce resources, if you might say, towards those that are highest risk. We certainly feel that our current operations have been geared towards that. The partnership that we have had with the Virginia National Guard to go to the skilled nursing facilities, and glad that they will be rejoining our forces again in early September to continue that effort. Certainly from an epidemiology standpoint, I agree with you that this is a population that's at higher risk than others. Again, codifying this into one specific bill, while we have many other groups as well, does present a specific challenge for us in the administration.
Thank you, Madam Chair.
Thank you so much. If there are no further questions, the next speaker is Scott Johnson.
Thank you, Madam Chairman. Can you hear me okay?
Yes, we can.
Great. I'm speaking today on behalf of the Virginia Healthcare Association. We have been working very closely with Dr. Jabari and the folks at the Health Department regarding testing. You probably saw that in the news this morning, additional testing activities that have been launched at the federal level. Obviously, we want to make sure for nursing homes and assisted living facilities, we've got adequate testing supplies and adequate testing timeframes to turn around to protect not only the patients and residents, but our staff. And so any effort that can advance this, we support and appreciate the partnership that the administration has given with us. Thank you.
Thank you very much for your comments. There does not appear to be any other speakers in queue, so I will now turn to the committee for questions.
Madam Chair.
Senator
Peterson.
Peterson.
Madam Chair, I feel compelled to speak on this. Like everybody else, we've been aware that nursing homes have borne the brunt of this epidemic, this pandemic, and it has an outsized proportion of the fatalities, not the sicknesses necessarily, but certainly the fatalities. I'm not quite sure what the harm is with this bill. It just simply says it's first priority. That to me is obvious, where 60 to 70% of the fatalities are coming out of one minuscule population. Why shouldn't they get first priority? So just sort of quote the commercial, it seems to me like Captain Obvious could figure this out. So I think it's a good idea, and I'm not quite sure I understand the opposition. So I'm going to support the bill.
Madam
Any other
Chair-
members of the committee?
Yes, Madam Chairman. Senator Donovan.
Senator Donovan.
Thank you, Madam Chairman. I very much agree with the senator from one of the parts of Fairfax. And I just want to say, listen, in medicine, you triage. You take limited resources and you prioritize the highest risk patients for the most immediate care. That's what we are attempting to do now, but we did not succeed very well with that in the beginning. In my district is Canterbury Rehab. It's a very good center. They worked very hard, but they were the location of almost all the deaths in the beginning of the COVID crises for Virginia. There were over 50 from that one nursing home. And the number one reason when we looked and did kind of the breakdown afterwards was that we were unable to get the results of tests. We were unable to get testing for everybody. We were unable to get results of the test, and therefore people were not quarantined that were actually spreading the virus. And it was catastrophic. I can't tell you how hard it was on the families when they couldn't see their family members. We've all had that from our district. We've all heard of it. So when you have a health crisis, we know so much more now than we knew when we left in March. We know where the risks are. Quite frankly, if 20-year-olds are positive for the test without any symptoms, the likelihood that that's going to result in death or hospitalization or ICU or ventilator utilization is almost none. So we have to begin to start using the science that we have to triage and tier our interventions. And this is incredibly appropriate that we say together that we need to prioritize the highest risk population where there has been most deaths, and we value that population, and we want to make sure that we strategically can intervene very rapidly for any future outbreaks, because outbreaks there will be deadly. Madam Chairman, I hope everybody will support this bill.
Thank you for your remarks, Senator Donovan. Any other member of the committee?
Madam Chair, if no one else wishes to speak.
Senator Chafin?
Thank you. Madam Chair, when I was first elected to the General Assembly, I was elected to the House of Delegates, and there was a retiring member there that I have a great deal of respect for. His name is Delegate Joe Johnson, and I was elected to his former seat. And I went to see Delegate Johnson to get some advice, to get some sage advice about what I should be doing and what I should be prioritizing. And the first words out of his mouth, Madam Chair, were, always remember those who cannot protect themselves. Always remember those who are unable to look out for themselves. They should be your first priority. And his words echoed in my head throughout this pandemic. And Madam Chair, I would point out to the committee, and I hope everyone in this committee will make this vote a positive vote, because it's the right thing to do for our senior citizens. But I will point out that our prison population is similar to the size of our nursing home population. And while that prison population got fully tested, our nursing homes did not. And while the prisons got the priority, Our nursing homes did not, and it resulted in this 60 to 70% death rate. Imagine what the story would be in the Commonwealth of Virginia in terms of the mortality if we had given priority to the nursing homes. We would have the best story in the nation to tell. I ask for your vote.
Madam Chairman, Senator Cosgrove.
Senator Cosgrove?
Thank you, Madam Chairman. I would move to report the bill.
It's been moved and seconded that the bill be reported. All in favor of reporting Senate Bill 5109. Mr. Clerk, would you please call the roll?
Senator Sasslaw. Senator Howe. Senator Newman.
James.
Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline.
Yes.
Senator Peake.
Yes.
Senator Edwards.
Aye.
Senator Chafin. Senator Hashmi.
Aye.
Senator Lucas.
Aye.
Ayes 14, no 0.
Thank you, Mr. Clark. Thank you, Senator Chafin. If Senator Lewis is still not here, we will continue to skip over that bill. Next bill is 5114. Senator McDougal.
Thank you, Madam Chairman. As I try to get my glasses to work as well. Madam Chairman, 5114, as you've heard me articulate on more than one occasion so far this special session and during previous regular sessions, that the connectivity of broadband internet is a tremendous problem in the areas where I live and represent. The vast majority of people have no access to high-speed technology whatsoever, and certainly the COVID pandemic has made that situation even more significant. So, Madam Chairman, with 5114, what we attempted to do is to make it clear that if your speeds are below 10 and 1, that there has to be an in-school option for children. Madam Chairman, the national standard to say high speed is 25 and 3, which is still not sufficient. Most people would not consider that high speed whatsoever. So this is even lower. But Madam Chairman, my 8-year-old is very fortunate in that she has the ability to learn the entire summer and has been. She's fortunate because we have taken the efforts to make sure she's doing that, to make sure that she is in some sort of academic instruction almost every day. But Madam Chairman, many families do not have those options and do not have the option to access technology for their children during the school year. This would ensure that those families have the ability to have their children learn over the next certainly 12 months and going forward.
Madam Chair. Madam Chair. Peterson.
Senator Peterson?
Will the gentleman yield for a question?
Yes, ma'am.
I'd ask the gentleman, it says, if any residential area in a local school division is not capable of receiving internet access at a certain speed, so let's say you had a couple farms or you had an area that was in, someone living in a ravine, or basically any neighborhood, any subdivision, any farm could not get high-speed internet. At that point, you're basically telling the school division what they have to do, which is in this case is they'd have to have in-person instruction. Is that correct?
Madam Chairman, I'd answer the gentleman. Certainly, I don't think the standard we picked is high-speed internet by any stretch of the imagination. That being said, why, when constitutionally we're required to provide education for children, why would we say, if you don't have the technology at your residence, it is not physically available, we're not going to give you that education? So the choice is, we either say we're going to educate our children and make sure they have access to it or not. Right now, Madam Chairman, I would strongly argue that we're not giving a significant number of children in the Commonwealth of Virginia the opportunity for education. This is a extremely low standard to be able to achieve that.
Madam Chair, speak to the bill at the opportunity.
Senator Peterson?
Madam Chair, I want to thank, as always, Senator McDougal, my classmate back in the House, for this bill, and I understand he represents a district much different than mine, but we have school divisions, we have local school boards that are making these choices right now about whether or not to do in-person or remote. And I've got my own opinion on it, and I have communicated that to my school board members. I know Senator McDougal will also, since we're both parents of school-aged children. But if we pass a bill like this, we're basically mandating them what to do based on criteria that are very arbitrary, in my opinion. So, again, I'll make the mistake of being consistent with my last couple of votes in this committee and saying this is a local school division issue. While there is a constitutional requirement that needs to be met, we cannot micromanage this situation from our desk here in Richmond, so I think we ought to pass this bill by.
Madam Chairman.
I can't see. Senator Cosgrove?
Thank you, Madam Chairman, members of the committee. Senator McDougal brings up an extraordinarily important point in this bill. I represent a large portion of the city of Chesapeake and of Virginia Beach, and you would think, well, there's internet everywhere there, but there is not. I represent the city of Suffolk, parts of Isle of Wight, in Southampton County, city of Franklin. There are many areas there encompassing a great number of school children who do not have access to broadband internet. You know, the schools are saying, we're going to give everybody Chromebooks so you can do this. Well, that's fine. The Chromebook is great if you have broadband, but if you don't, it's a doorstop. So we are constitutionally required to provide an education to every child in the Commonwealth of Virginia. And we are failing to do that if they do not have the access to the technology that we are depending on. Now, I agree. I don't like to micromanage the school boards either. Everybody knows my chief of staff is a school board member. But at times like this, I think it is extraordinarily important for us to meet our constitutional requirement and have some type of mandate so that these children can be educated, because right now we are failing them. Thank you, Madam Chairman.
Madam Chairman.
Senator Donovan.
Thank you so much, Madam Chairman. I would like to offer some counterpoints to my friend from Fairfax City. First of all, the school boards were already derailed from being able to make decisions that were consistent with the values of the children they were educating and their families, because instead of saying, go solve the problem, Virginia school boards, the state said, go and find a way to implement these guidelines. That was the direction from the state while we were not convened. It confounded the ability for school boards to make the decisions based on local politics, which is what we are attempting to achieve by protecting the independence of our school boards, as they are closer to the people and are better able to discern how to proceed. The guidelines that they were directed to follow were in conflict with the CDC, they were in conflict with the American Academy of Pediatrics, and they created what I called an unsolvable puzzle for our school boards. We have a report from the state that 200,000 children of school age in Virginia do not have access to broadband. 173,000 do not have computers at home. Yet most of Virginia has gone to virtual learning. It is entirely appropriate for the General Assembly to give a counter perspective to the direction that was given by the state when we were not in session, and say, okay, this is where we are. Aren't we here to solve COVID problems for this session right now? This is where we are right now. We recognize the deficits that have been created by the decision-making that we've gotten to this point. Let's find a way to make it work for everybody. And for that reason, 200,000 kids spread across 132 school divisions would very easily be able to maintain social distancing. This is an appropriate way of us fulfilling the obligation the Constitution makes to every Virginian, and I strongly encourage this committee to support this bill.
Madam Chair, Dave Suderline.
Senator Suderline.
Thank you, Madam Chair. I so rarely speak in disagreement with the Senator from Fairfax City on things like this, but I think that Senator from Henrico is exactly correct. The Commonwealth regularly mandates very specific things regarding K-12 education to specific staffing ratios, regardless of what might be in that individual school district's best allocation of their resources. The governor mandated that all the schools shut down for the entirety of the summer. He then, during the summer, tried to make it so that they would all have almost the exact same return plan with the guidelines being provided the way that they were. It wasn't until the junior senator from Virginia Beach pointed out that their statements, if they were actually to be mandated and not guidance, would violate the state constitution. I think that making sure that our students actually have their K-12 education that they're constitutionally entitled to, we go all, and it's great that we do it, we go through all these things to make sure kids that don't have access to lunch unless they're at school, that they were able to continue to receive it. We found ways, and the schools did a great job in trying to get that to those kids. We need to find a way to get education into the hands of these children who don't have internet access at the levels necessary to receive the education through the virtual program. So I hope we will support Senator from Hanover's bill.
Madam Chair, this is Ghazala Hashmi. Thank you, Madam Chair. I just want to stress the point that the American Academy of Pediatrics is a little bit more nuanced than just recommending that students go back to school wholesale. They actually say that local school leaders, public health experts, educators, and parents must be at the center of decisions about how and when to reopen schools, taking into account the spread of COVID-19 in their communities and the capacities of school districts to adopt safety protocols. This decision to reopen schools is a complex one. I fully sympathize with all of the parents, the students who are struggling and facing this crisis of education, but it is at the heart a healthcare concern, a healthcare issue, and it is best left up to the individual communities and the local school boards who have been elected to make this decision. We're not just facing a crisis of not having broadband access in certain rural regions. We're facing a crisis of also not having sufficient technology in the hands of the poorest in our communities. These individuals, even if they do have broadband access in their communities, many of my students in the city of Richmond don't have the capability to actually pay for that service. Many of these students are also facing a crisis of homelessness. So this problem is very profound, it's very serious, it's very broad, and it is a decision at this point that we have to leave in the hands of our local school boards. Thank you, Madam Chairman.
Thank you, Senator Hashmi.
Madam Chairman. Senator Donovan.
Senator Donovan.
I just want to make a couple
Senator
of...
Donovan, I just want to apologize because I have to turn around and try to see where people are because I can't recognize you. I know we all separated like this for a reason, but I can't see you. So if you all will raise your hand, that would really be helpful.
Yes,
Senator
ma'am.
Donovan.
Thank you, Madam Chairman. I just want to make a couple of points. I actually agree with the senator from Chesterfield. This bill should include every child that doesn't have access to getting the curriculum wherever they are. And we should include it beyond people who don't have broadband. And we should make sure kids that don't have computers. Do you know I have parents that have reached out to me that have 3 children in school, and the school schedule is such that all 3 children have to be on the device in the home at the same time. They don't have 3 devices, even if they do have broadband. There are some serious flaws with how we're proceeding with education that have arisen out of COVID in the situation that we're in, and that's what we should be here fixing. And any child who is homeless, I'm going to say again, school is so much more than curriculum. The senator from Chesterfield is correct. We have children who don't have food security. 40% of our children are on free and reduced lunch. That means their families are at 130% of poverty or less. They don't have a safe place to be. That is why we invest in schools and the experts that we have there. So I agree with the senator from Chesterfield. We should be including more people because there are more crises that are evolving beyond broadband. But the American Academy of Pediatrics said almost again and again and again, don't let that be an obstacle to returning to school. For every variable that came up, they wanted to offer a solution. And they did say, leave the decision with the school boards, not have the state tell the school boards how to implement a process that would not result in the outcome recommended by the American Academy of Pediatrics. Thank you, Madam Chairman.
Thank you, Senator Donovan. We've got to move this along. We have one more vote, one more bill by Senator McDougall.
Madam Chairman.
We don't have any speakers signed up to speak. So, committee, was that?
Madam Chairman, Senator Cosgrove, I moved a report.
Madam Chair,
Senator Peterson.
with some trepidation, I'm going to make a substitute motion to PBI.
It's been moved and properly seconded.
Madam Chairman, this is McDougall again. Can I get one word in after everybody else spoke? Just a last plea.
I think everybody has spoken. We have 2 motions on the floor. The last motion was the PBI. So, Senator McDougall.
Madam Chairman, I understand the concerns, but we have seen a number of school systems even allowing children to be in person in the school system, but not necessarily having the opportunity for education for people that can't get them there. Some of the areas I live in represent, it takes over 30 minutes for you to drive to the public library where it's the only place that you could have wireless internet, and you have to sit in the parking lot to get speed where you can do anything. So, Madam Chairman, I certainly think some of the arguments made by the senator from Chesterfield and senator from Henrico that this bill could be expanded. But if we don't take some steps to make sure that our children are being educated in person, we are giving up a generation. They missed most of last year. They could miss most of this year. We need to ensure that that does not happen. Thank you, Senator Edwards, for that emphasis.
We have a motion on the floor for the bill to be passed by indefinitely, and it has a second. Mr. Clerk, could you please call the roll?
Senator Saslaw. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline.
No.
Senator Peake.
No.
Senator Edwards.
Aye.
Senator Chafin. Senator Hashmi.
Aye.
Senator Lucas. 8 ayes, 6 nays.
The bill is passed by indefinitely. The final bill for this committee today is Senate Bill 5116. Senator McDougall.
Madam Chairman, I'll make this one quick. This is in 2 sections, and it's a topic that we took up in the biennial appropriation earlier this year in regular session, and it's dealing with electronic visit verification. Madam Chairman, the issue is that individuals who reside in the home, typically parents, but it could be somebody else, also have to go through this electronic visit verification system, meaning they have to have an app and they click in and out all the time when they're providing services for their child. Madam Chairman, that is incredibly cumbersome and difficult, and we need to have a better process for those family members that are in the home taking care of their children. So, Madam Chairman, this bill is in two parts, A and B. A, I think, restates what we're already doing. B is the crucial part, and that individuals who are providing those directed services but are residing in the home of the individual for which they're providing the services would not have to participate in the electronic verification. So, Madam Chairman, I know we got an impact statement just about an hour or so ago. I would quibble with the decision because A is already in place. This is just creating a system for those limited situations when the family members are taking care of their family members in the home, and they would not have to file electronically.
Thank you, Senator McDougal. We have several speakers signed up for Senate Bill 5116. It's David Broder on the line, Mr. Clerk.
Yes, I'm here, Madam Chair. Can you hear me okay?
Yes, we can.
Thank you very much. I'll be brief and I'll apologize in advance for when you hear my dog and children in the background. My name is David Broder. I serve as the elected president of SEIU Virginia 512. On behalf of our frontline home caregivers, we are proud to support Senator McDougal's bill, SB 5116, to exempt live-in caregivers from the EVV system. We know that older adults and people with disabilities rely on home care to live independently at home in the community and to stay out of nursing homes and other institutional settings if that's their choosing. With so many COVID outbreaks right now occurring in nursing homes, home care has never been more essential. Unfortunately, the EVV system has created significant and unnecessary burdens on older adults, people with disabilities, and their families. Many Medicaid recipients and providers lack the smartphones and broadband that makes EVV easier to use. And when the EVV apps do not work, as happens with all apps, the providers may not get paid. Older adults and people with disabilities can lose their caregivers. So I'll wrap up here. We ask you to advance this bill to exempt live-in caregivers from EVV. We thank the patron. We think this will remove a barrier to life-saving, quality home care for older adults and people with disabilities. Thank you very much.
Thank you very much. The second speaker is Lisa Smith, and we have 4 speakers remaining for Senate Bill 5116.
Hello, can you hear me?
And I'm going to ask the remaining speakers if you could please keep your remarks to about 2 minutes because we have to move on over to the next committee before session starts. I would appreciate it very much. Good morning.
Good morning, Madam Chair and members of the committee. Thank you for allowing me to speak today. My name is Lisa Smith. Many of you might recognize me because I'm usually pushing my daughter Haley in a stroller, and about 5 years ago she had a seizure in this very committee. Haley is now 20 years old. I am her full-time caregiver, and I think you can hear her laughing in the background. Haley needs help with all activities of daily living. She cannot dress, bathe, or care for herself, and she has zero safety awareness. Despite this, her waiver thinks she only needs 6 hours of service hours a day for care. The electronic visit verification system requires me to sign in and out for that 6-hour shift, and it is truly arbitrary when I sign in and out, but it must be in real time. I truly understand the value of this requirement if the caregiver is not living with a loved one and you want to make sure someone's there for your family member. I have set alarms to remind me when to sign in and out, but more often than not, I have to sign out or in manually, which triggers a flag on my account, and Haley could lose her services, or at least we're threatened with that. Many times we're in the car and I can't pull over to sign out, or I'm making dinner, or there's a true emergency. I'm going out on a limb today to ask all of you that you've been parents or have been around someone who's raising a toddler. My daughter is 20, but she is basically a toddler. Just this morning, we've had a seizure. We've had to change all the bedding on her bed. She has a very bruised toe, so at some point she has broken her toe in the last 24 hours. And all of this, I have to also sign in and out of my shift. I have As I've stated, caring for those who are disabled is not a visit, as this program is for. It is a 24/7 job. Having to remember to sign in and out of the app for an arbitrary shift is very burdensome on my family. The federal law already allows for exemption for live-ins. Virginia has not recognized this. It is very easy to figure out who is a live-in caregiver because we are tax exempt and we are also allowed to go over 40 hours. So for DMAS to find out who we are, it'd be very easy and not cumbersome. So thank you for letting me speak today. We appreciate the time.
Thank you so much. Next speaker is Teresa Elder. Teresa Elder.
Yes, I'm here. Sorry. I had to find the unmute button. Can you hear me?
Yes.
Hi. Thank you for giving me the opportunity to speak. My name is Teresa Elder. I'm better known as Tommy's mom. My son Tommy is 27 years old and much like Haley is developmentally a toddler. I've already spoken in Fairfax in January to the Fairfax legislators about the EVV issues, and I know you've heard, and you all already know the burden. We're not visiting. We live in constant fear of non-compliance, which puts us in jeopardy of losing our services. So I want to give you a personal story and tell you what happened to us this year. Tommy had a bad seizure and aspiration and ended up in Inova Fairfax Hospital on April 27th. He was put on life support and moved to the ICU, and I was told I could not be at the hospital with him, and they would call me if and when he was extubated. I used my connections at Inova, and after much hardship going all the way to the top of the actual Inova system, I was allowed to go in, but I could not leave. In the beginning and periodically during my son's 45-day stay, I literally couldn't leave the ICU room for anything, not even to go to the bathroom. I cannot begin to tell you in my short time here what happened, but I'll sum it up by saying if I had not been there, Tommy would have been moved to Richmond to a long-term care facility with absolutely no visitors, or he would have died. I can say this because those were the words that one of the ICU doctors told me when we left. My point is this: I can assure you that I didn't stay in that hospital with him to gain some kind of recognition. I did it because my son needed me there. I also can say that we don't keep our son at home and care for him, and now he also has a trach, which is extra care, so that we can get paid $12 an hour to care for him. It isn't about money, and it isn't about frauding the state. It's about quality of care and trying to live our best life. I appreciate all the doctors, expertise, and medical care, and I'm also thankful for the services that the state provides so that I can keep my son at home where he belongs. That's the whole point. We're not visiting. Therefore, we don't even meet the criteria of having to sign in and out to care for our family members in our own homes. We take on a lot of burden very willingly. Please support this bill and don't add extra burden by making us continue to log in and out caring for our medically fragile family. Thank you very much.
Thank you very much. Next speaker is another Teresa Champion. Yes.
Morning.
Good morning.
Thank you, Madam Chair. My name is Teresa Champion, and I'm representing the Virginia Autism Project in this matter, and I'm here in support of Senate Bill 5116, and I'd like to thank Senator McDougall for putting this bill forward. I also want to give a shout out and an amen to all the speakers that have spoken before me, and I think they hit all the high points. But I want to say that the Center for Medicaid Services has recognized the unique nature of live-in caregiving. And they have said specifically in their memorandum dated August 8th, 2019 to the question, do EVV requirements apply if the individual personal care is living in? No. EVV requirements do not apply when the caregiver providing the services and the beneficiary live together. We live in, we are not visiting. I have a few show and tell items. The way I tried to remind myself to clock in and clock out, stuck all over the house so that I can visually try to remind myself. And here's my little app I have with me to do so. This is ridiculous. And it's unique and it's been recognized. We're not here to commit any fraud. We're here to care for our loved ones. The financial impact of this is vastly overstated, and I think we're all familiar, having been involved in legislature in the past, that frequently happens, that the dollar number is overstated, and it's scary. They all know who we are. They have us on record already. It is not a problem to exempt us from this program. I express my support for all the comments that have been given, and I ask you to remember the vulnerable and their overwrought caregivers and many who can't be here to speak today. Thank you.
Thank you. Our last speaker for Senate Bill 5116 is Athena Jones. Is Athena Jones available?
Hi. Can everyone hear me?
Yes.
Excellent. Yes, hi, my name is Athena Jones. I am a home care worker. I've done it officially since 2006, but unofficially I have done it all my life because I am actually a sister who takes care of a family member. I'm also a member of SEIU Home Care 512. The reason why I'm here, people have stated it and overstated it, and I think it needs to be stated yet again. We become the ambassadors to our community, to the world. And when we are the ones that live at home, and we are the ones that take care of our home care work, our members, like Teresa said, I actually have 8 prompts on my phone to make sure that I clock in and clock out on time because we are scared of the potential repercussion if we don't do the system correctly. Home care workers are just trying to survive. And with low wages, with no health insurance, with no benefits, we don't get a 401k, but yet there's a system in place that has allowed us to be treated as if we are the villains. We actually save the state millions of dollars because our family members are not in homes, because our family members, we choose to keep them with us because we love them. If you choose to outside of that, I understand. But if you have the option for them to stay at home, God bless you. The system should be there to support that. So as a home care worker, as a sister of someone who I love very much, and as a political activist, this bill and the amendments to it are important. And also the fact that home care workers, many of them, we don't receive, under consumer-directed services, don't receive overtime pay. And so please take into consideration that, again, many of us earn less than $10 an hour. And like I said many years ago, that in 2000, whatever, a TV show was talking about how great $10 was in 1992. And it's sad that we're at 2020 and we're still excited if anyone gets $10 an hour. And so please take into consideration all the testimonies that we have, all the loved ones that we support, because at the end of the day, you want an amazing life, and we want to make sure the members that we have that are a part of us also have amazing lives. Thank you, everyone, and thank you, Madam Speaker.
Thank you very much, Athena.
Oh, thank you, Madam Chair. I want to assure everyone who has testified that we are very aware of the crisis that's happening with home care workers. We've been doing our best to provide some benefits, hopefully reasonably large numbers of benefits in the not too distant future, as well as increase the payments. And this particular issue is very much on the forefront of our minds. In fact, we were planning through the budget itself to get rid of this requirement. But we have a bill, and that's fine. So I would like to move that we report and refer to finance this bill.
It has been moved and seconded that the bill be reported and referred to finance.
Madam Chairman.
Senator Donovan?
I just briefly want to say this is an administrative process that we put in place to make sure that families who had members with needs did not failed to get the interventions by providers who came in from the outside. The overlap that we've made with people who care for their own families at home has created a hardship for the same families we sought to protect. This must go away. I agree with the speaker that the funding to not have them log in, the absence of them logging in, cannot possibly cause the state anything. So I am happy to support passing. If it has to go to finance, we'll re-refer to finance. But thank you, Madam Chairman. I just needed to advocate.
Unless there are no other speakers, Mr. Clerk, would you please call the roll?
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Sudeline.
Yes.
Senator Peake.
Yes.
Senator Edwards.
Aye.
Senator Chafin. Senator Hashmi.
Aye.
Senator Lucas.
Aye.
Ayes 14, no 0.
Thank you, Mr. Clerk.
Madam Chair,
Senator Newman?
unless there's someone here to present Senate Bill 5064, I move they go by for the day.
It's been moved and probably second that Senate Bill 5064 go by for the day. There are no other bills in the committee, so the committee shall rise. Thank you so much.